So the question we were looking at in my group was the pros and cons of youngstock testing versus tag testing. Youngstock testing meaning antibody testing, serology, and tag testing meaning virus testing or antigen testing, sometimes called. A couple of, I'll run through some of the pros and cons of each. So youngstock testing can be brilliantly sensitive. It can be an excellent screen, especially at the beginning of eradication. It requires veterinary involvement because it's a blood sample. So by definition, the farmer's already talking to his vet. It can be very cost effective, especially as the herd gets bigger. It can be cheaper than testing every individual calf. However, on the downside, it's serology is always complicated to explain to farmers and sometimes to vets too. And it can be complicated to interpret, depending on the results. It's only a snapshot. It's only true for the day it was taken. It will change if disease exposure in that herd changes. So it has to be done reasonably regularly to give you a picture of what's going on. It's hard to do well because you have to test representative animals in the herd. And so it relies on a good relationship between the farmer and the vet, and it requires the vet to be well trained and well informed to choose the correct animals to test. Some farms won't have suitable young stock of the correct age group, so the test will be less meaningful potentially in that herd. Vaccination can complicate matters. If you do a young stock test on a bunch of young stock that you vaccinated a couple of months ago, your results are going to be pretty confusing because you're going to pick up vaccination. And depending on the timing, it won't necessarily give you the status of the annual herd, depending on your herd structure and the timing of when you start check testing. So tag testing, for comparison, the benefits are that it's very easy to understand, it's very easy to explain, it gives a lifetime status for that individual animal. The farmer can do it himself. You can infer the status of the dam. If the calf is negative, you know that the dam cannot be a PI. So you get two results, really, for the price of one test. There's buyer confidence, potentially, if they see a BVD tag in an animal's ear. And there's the potential for these management tags to have multiple uses for genomics. As Maria pointed out, that can also apply to blood samples. They can be used for multiple tests too. The downsides of tag testing potentially are lower quality submission forms if the farmer's filling them in themselves and they're maybe leaving parts blank because they don't realise that the lab genuinely needs all the information. There's the potential that some of the calf crop is missed. The farmer may not test his stillborns, may not be testing abortions. So although the herd status requires all calves to be tested, they're only testing those that are registered on CTS or the official ID database. There is a problem with user error where, especially when people are getting used to a new tagger, new tags, you might get empty samples, and there's an issue potentially with sample quality if farmers are hanging on to samples until the envelope is full, and sometimes these samples are quite old, and sometimes they're being stored at room temperature rather than, say, in the fridge. So that may have an impact on the quality of the results, the accuracy of the results. So, in summary, they're two completely different tests. They're doing completely different jobs. One is a survey, the other is an individual status. There's nothing to stop a farmer from doing both on his herd. I know some farms in Scotland where that is happening. But ultimately, the test that is appropriate for the farm will depend on herd size, on exposure to disease, on management practices, and what the neighbours are doing. So really the choice of test has to be a conversation between the farmer and his vet, where both of these tests are. In Scotland, both of these options are available to get herd status. And really the choice of the correct test needs good veterinary input. I think that's me.